everyone, I'm Hanin Khundukar. Today we will talk about dementia. Let's start by this case. A 75-year-old woman is evaluated for agitation and confusion while hospitalized. She was admitted 4 days ago due to a fever, productive cough, and shortness of breath. The patient was diagnosed with community-acquired pneumonia and her condition has improved with antibiotics. However, for the past 2 days, she has had episodes of confusion and agitation, especially during the evening and night. The patient's medical history includes hypertension, osteoarthritis, and mild dementia. She lives with her husband and senior living facility and is able to perform her daily activity with minimal assistance. Her temperature is 37, blood pressure is 130/80, and pulse is 84 per minute. Pulse oximetry is 98% in room air. The patient recognizing her husband at the bedside, but is not oriented to the time or location. During examination, she repeatedly tries to climb out of bed, but climb when routine. The patient follows simple instruction and has no focal weakness or sensory loss. She has moist mucous membrane and prickles in the right upper lung. Laboratory testing show an improving leukocytosis and normal electrolytes. Okay, which of the following would be most helpful in management of this patient? This hospitalized patients with acute onset agitation and confusion associations with disorientation and increasing motor activity, tearing of clamping out of bed frequently, especially in evening and night, likely has a delirium. This is condition can be seen in the hospital in any hospitalized patient, but most often occurring in the elderly and those while underlying dementia or previous stroke, likely due to reducing cognitive risk. It is thought to be related to increasing oxidative stress, neuroinflammatory mediators, and impaired of neurotransmitter function. It's occurring relatively quickly over hours today, not years like dementia, and manifested with facilitating severity is variation during the day, better in morning, worse at night, and changing in level of consciousness. Um, Participating factor, when we talk about participating factor, are listed in any accompanying table. Delirium is reversible in the majority of cases. That's the better thing. Management, including identify and treating the underlying inducing factor, like this patient, she have a pneumonia, we can treat it by antibiotic, as well as introducing non-pharmacological measures such as reducing of nighttime noise and disturbances, frequently variable orientation, reassurance, interaction with family members, or presence of treating sisters at the bedside. Now we turn to the questions and analyze the show. Which of the following would be most helpful in management with this patient's current condition? Ensure bed rest to minimize falls. Okay, it can worse agitation and resulting in impaired mobility and pressure ulcer. Uh, if we talk about initial low dose of benzodiazepine therapy, rapid onset of action that can be used to control agitation and competitive behavior. However, they can have a paradoxical effect in the elderly by causing disinhibition and therapy worsening delirium. in the D, previous sensory overstimulation to keep the patients attentive. Okay. Can worse delirium by most patients have improved outcome by interactive with the family. Uh, Reduce nighttime noise and disturbances. This is the correct choice as we talk about it. Use the soft bilateral physical restraint can worsen agitation and lead to worsening confusion by not allows for the proper rest. This is a quick idea about delirium. We have a risk factor like advanced age, neurological disorder like dementia or stroke, sensory impairment, hearing loss, precipitating causes, central nervous system, either a seizure or stroke, infection, pneumonia, urinary tract infection, medication like sedative, metabolic disturbance, electrolyte, or uremia. Clinical features, acute onset of the fluctuating mental status changing, disturbance in attention, sleep-wake cycle changing, and management, avoid the polypharmacy and maintain normal sleep-wake cycle, uh, uh, provide frequency reorientation and treated the underlying causes by antibiotic, like example if we have pneumonia. Okay, as a home message, delirium is a reversible disorder characterized by the agitation and confusion, most frequently seen in the elderly or those with underlying dementia. Determine the underlying causes, avoiding unnecessary medication, treat confusion and metabolic disturbance, and encourage regular activity during the day while minimizing the disturbances at night can help patients recover more quickly. Thanks for all.